The housekeeping issues for us all to follow. Please switch off or make silent your mobile phones and all other devices, and keep microphones switched off at all times unless invited to speak. When invited, please switch on the microphone nearest to you and introduce yourself. So with that, we'll move on to the agenda. Item 1, public questions. There are no public questions for today's meeting. Item 2, can I have a mover and seconder of the minutes for the meeting on the 18th of September, please?
Move it, Chair.
A seconder, please.
Second, Chair.
Thank you. We agree the minutes are a correct record? Okay, I can confirm that the minutes are agreed. Item 3, declarations of interest. Are there any declarations from members? No. Item 4, review of customer access point service offer. Can I invite Paul Darby, Corporate Director of Resources, to present the report, please?
Thank you, Chair, and good morning, members. This report provides Cabinet with proposals to adjust the face-to-face service offer delivered in the Council's customer access points, reflecting the reduced face-to-face demand we've seen across all access points over recent years. The report sets out the findings of the consultation undertaken, as well as an equalities impact assessment on the proposed new service offer, which can be put in place earlier than originally planned. Members will recall that last year we reduced the opening hours of 4 of the least use caps. However, despite this, 60% of the appointment capacity across the whole of the estate remains unused, and in some locations seeing just 22% of appointment time taken up. Therefore, to ensure the Council is making the best and most responsible use of its resources, a further review of face-to-face customer service offer has been undertaken. This review aimed to establish the impact and potential benefits of moving from a traditional building-led cap operating model to a more responsive offer with a focus on delivering customer service support to the places it is most needed and reducing the time spent in current locations to better reflect demand for the service. A public consultation exercise was undertaken between the 7th of May and the 28th of July earlier this year to gather views and options to serve the wider community. The recommended option, following analysis of the data, resident and member feedback during the consultation process, is to evolve the current operating model into a surgery model operating 1 day a week from the current locations, with additional locations in Peterlee and Newton Aycliffe also opening on 1 day a week to better reflect customer demand and increase accessibility in the east and the south of the county. The proposals which are set out in the report are aligned to the corporate asset management strategy and have taken into consideration input from other council services, including culture, sport and tourism, and children and young people services, to ensure co-location plans reflect the total place approach. There is a full equalities impact assessment attached to the report, which recognises that older age groups, particularly those over 65 and people with disabilities, are more likely to access face-to-face provision at our caps, and this is reflected in the percentage of consultation respondents from those groups. Whilst the proposal will lead to a reduction in the open hours of our current caps, which will impact on some, the service is not being removed and it's been remodelled on a demand-led basis to provide a broader reach and better access to more residents via the introduction of more locations and alternative access channels. The proposals will allow for resources to be better aligned to alternative contact channels, all of which have seen a substantial increase in demand since the pandemic, thus benefiting all customers in terms of access. Reasonable adjustments will continue to be made where necessary for customers with disability and language support for customers whose first language is not English. The communications and engagement plan is set out and we will promote the new service offer to all customers who access these caps over the coming 12 months to ensure there's a smooth transition to the new arrangements. The recommended option can be implemented in all locations apart from Durham City and the Clayport Library from around about October next year, facilitating the early delivery of £160,000 of the £219,000 of MTFP savings aligned to 26-27. The Clayport Library cap is being considered as part of a wider corporate asset management strategy with longer lead-in times, and savings associated with that location will remain profiled for 26-27 at this stage. Chair, the recommendations are set out at paragraph 20 to the report. Thank you.
Thanks, Paul. Can I invite Councillor Susan MacDonald, Cabinet Portfolio Holder for Digital, Customer Services and Procurement, to move the report, please?
Thank you, Chair, and can I thank Paul and his team, particularly Vicky Murray and Sarah Welsh, for their work in pulling together this report, and especially for the work undertaken throughout the consultation process, engaging with our residents and communities to ensure that their views and suggestions were also considered prior to the production of the report. Can I also thank the Corporate Overview and Scrutiny Management Board for its consideration of this report on the 3rd of October, and I note their comments which are set out at paragraph 69. The report clearly sets out that demand for the CAPs has decreased year upon year, with appointment take-up falling by 16,000 per annum since the launch of Universal Credit in 2018, and visitor numbers dropped even further following the pandemic. Demand and football in the CAPs in 2023-24 was only 33% of the levels we saw in 2017 and 18. With such a change in customer contact, we had to review our service offer to better align with the needs and demands of our customers, while at the same time ensure we maximise the efficiency and effectiveness of the service. Put simply, we have to move with the times. I welcome the proposals to expand the service offer to provide surgeries in Peterlee and Newton Aycliffe, a gap that needed filling and one which I'm sure will be welcomed by those communities. The proposal sets out in this report have been consulted on extensively, with officers making presentations to all of our AAPs, an online service sent to all of our CAP users, and the consultation was promoted extensively via our social media channels, along with paper copies being made available for our members via our member services team. In total, 679 residents responded to the consultation. Quite a low level of participation, but reflective of the decline in the demand for face-to-face access, and it was actually 41% more than the CAPS consultation response we had back in 2023. Of course, implementing change is not always universally popular, and there will be a need to carefully manage the move to a new service offer. With this in mind, I welcome the comprehensive communication plan attached to the report, which will ensure that there is a smooth transition to the new service offer over the coming 12 months. And I welcome bringing the changes forward to next year, rather than perpetuate the current inefficiency for longer. We just can't sustain a position where 60% of appointments remain unused, particularly when we have such financial challenges ahead of us. And I fully support the bringing forward of £160,000 of MTFP savings to 2025-26 on the back of these proposals. With that, Chair, can I move the recommendations as set out in paragraph 20? Thank you.
Thanks, Susan. Can I invite Councillor Alan Shield, Cabinet Portfolio Holder for Equality and Inclusion, to second the report, please?
Thank you, Chair. Can I also thank the officers for this report and all those that participated in the consultation and engagement on these proposals. I have said on many occasions that decisions that we make as a Cabinet must be information-based and evidence-led. And in this case, and let me stress, the evidence is clear. The need to implement change is unequivocal. The report sets out clearly the changing demands from our customers in the way that they access council services, which has seen a significant and sustained reduction in face-to-face appointments across all the customer access points, with a definite move towards the alternative digital or telephone methods of customer contact. Given this change in customer behaviour, it is wholly appropriate that the customer services provision was reviewed and that our provision evolves to match the customer demand. Like Councillor MacDonald, I welcome the addition of the new CAP surgeries in Peterlee and Newton Aycliffe. I note that the Corporate Overview and Scrutiny Management Board raised some concerns about the level of engagement with those staff affected by the proposals and their respective trade unions. Whilst not included in the report, I can assure Cabinet members that all formal processes have been followed and the relevant trade unions have been consulted as part of the initial savings proposals developed for the MTPF. With the formal HR consultation process only beginning after formal decision has been made, this is standard practice. As Equality and Inclusion lead, I read with interest the impact assessment attached to the report, and I am satisfied that sufficient mitigation is in place and is appropriate to ensure that any and all reasonable adjustments will continue to be implemented. The long lead time for implementation of these changes, which will come in from October next year, will help with managing this change and ensuring that our residents, who are our customers, are made aware of the planned change in the opening hours. With that, Chair, I second the report and recommendations set out in paragraph 20. Thank you.
Thanks, Alan. Is there anyone else wishing to speak to the report? Mark?
Thanks, Chair. With these proposals, we're not only continuing to offer surgeries in all existing locations, but expanding it to include Peterlee and Newton Aycliffe. And we're able to save money for the council. So, for me, Chair, it's a no-brainer to support these recommendations. Thank you.
Thank you. Is there anyone else wishing to speak? Okay, can we agree the report and its recommendations? Okay, I can confirm that the recommendations are agreed. Item 5, the Director of Public Health Annual Report 2024. Can I invite Amanda Healy, Director of Public Health, to present the report, please?
Thank you, Chair. Morning, morning members. As ever, this is my statutory annual report as Director of Public Health here in County Durham. It's a responsibility for myself to write the report and for Cabinet and the Council to agree to publish the report. Last year's report was a time of looking back over kind of 10 years of public health in local government, and this year's report has been very much more focused on looking ahead to health and well-being, looking at some of the challenges that we will face and how some of those health challenges fall unfairly across our county, and then most importantly what we can collectively do to meet those challenges. So the report's in kind of three parts. One which looks at the health of our people, and that's where we use the work of our Joint Strategic Needs and Assets Assessment. The second section looks at that future health of our population, the projections that we have for that through to 2040. And the third part of the report reflects on the actions, the evidence-based actions that will mitigate the projections that are in the second part of the report. Throughout the report, we've used evidence-based examples, but real stories from our residents to bring to life the work that we either are already doing or need to do to meet the health challenges. And that's why the title of the report is Unfair, and actually also avoidable. You will see in the report, in terms of the health of our residents locally, that there is a range of things that make up people's health and well-being. We know that in County Durham, for a baby boy born in County Durham, the life expectancy is still 77.9, which is almost 1.5 years lower than the England average. And for a baby girl born today, it's 80.8 years, which is still 2.4 years lower than the average for England. And you'll see in this slide a range of statistics which help to guide us in terms of where County Durham is either significantly worse or significantly better than other parts of the country. And a couple to just draw out are things like our childhood obesity rates, for example, which are higher than in other parts of the country. However, our bowel cancer screening rates that are better than in other parts of the country. And I guess the message with this report is using our local data to target our resources in the right way and to use our funding and our influence to best effect. The differences that we see, however, don't fall fairly, and that is something which we really do need to think about. You'll see more detail in the report about the geographical spread of those inequalities, particularly in the eastern parts of our county, but also how that needs to be overlaid with other characteristics, sometimes some of our protected characteristics, sometimes some of our socially excluded groups, such as those people who are homeless, for example. And the report helps us then to think about where we target our interventions, where we put our best effort to bring about a change. You'll also see in the section of the report where we've started to really use our tools and techniques to get a deeper understanding. And we did what's called a health equity audit of our women who are smoking at time of delivery. And what we have found is great variation across County Durham. From one part of County Durham where 1 in 3 of our mums are smoking at time of delivery compared to 1 in 20. So again, this information really helps us, and we're already working with our clinical directors, and you'll see in the report our health inequalities midwife, how we're seeking to bring about change and some of that area-based working that is needed to reduce those levels of smoking at time of delivery. However, that all sounds pretty deficit-based and quite challenging. How we go about this in County Durham is really important, and we have our set of principles which are adopted within our council plan, Vision 2035, for our approach to wellbeing. And this is about thinking about how we work with our communities, because the more we work with our communities and the more control people have over their decisions about their health and well-being, the better their outcomes will be. And some of those approaches are embedded within our commission arrangements. Think about shared decision making. We empower communities and how we use evidence, but also have really good conversations with our local residents in terms of their health and well-being. And you'll see some great examples in the report where the approach to wellbeing has been used to develop work, such as our Growing Up in County Durham strategy, a more recent sexual health strategy. And we're embedding that in our new approach to research, particularly working closely with Durham University. And some in-depth work with our people in terms of carers and dementia, which also help to inform our work. And obviously we've got adult social care report coming up next. So that's very much about putting evidence into practice. And I think a good example of that is the work that's been taken place through one of our community champions, Becky Land, who was a farmer in County Durham. And what Becky was saying was that we live in one of the most beautiful parts of the country, and yet farmers face at times significant hardship, both physically and mentally. So Becky was motivated to become a community champion, work closely with Healthwatch and our healthcare colleagues. And actually what that resulted in was a change in service provision, so that actually rather than people having to go to the GP surgery, which was quite a trip and time and effort, was actually outreach and then carrying out health checks on some of the farmers. Undiagnosed conditions were found and were able to either be prevented or treated in 63% of the people that came forward. So a real great example, I think, of where people involving people who know most about their health can bring about change. The second part of the report is looking ahead and really thinking about the future health of our people. We've worked with the projections from the Health Foundation, but also projections that we've developed locally. And you'll see in the report there are a range of major illnesses that make up our gap in life expectancy and healthy life expectancy. And we've looked at those and projected those forward. And they are a challenge for us to look at, because they, again, reflect both the where those projections will fall. So, for example, what we will see potentially in County Durham by 2040 is that over 86,000 of our residents, 1 in 5, could be living with a major illness. So that is an increase of 39%, or 24,000 people. And again, that will impact on every part of people's lives, on our economy, how we have our leisure provision, etc. So this is a really important consideration for us in terms of the impact of that. What we also see, however, again, is that that does not fall fairly. So what we'll see is we'll see a 46% increase in our areas of greater deprivation compared to 35% in our least deprived parts of the county. So that difference is unfair, and we really need to think about and guide us in how we reach people within those either geographical areas or those population groups, and then everything that we do. It is then reflected in, we've picked out a couple of the major illnesses, and we'll be working on these in the years ahead in terms of the mitigations against these projections. But if we took cancer, for example, what we are likely to see by 2040, unless we accelerate some of our work, is that there'll be 29,000 people in the county could be living with cancer. However, again, what you see in that increase is a great difference between areas of greater affluence compared to those that are more least affluent. So 37% increase in our most deprived areas, 21% in our least deprived. And the pattern is similar for anxiety and depression. What we'll see again there, the potential of 89,700 people living with anxiety and depression. And if you think about the potential impact of that in terms of, you know, sickness in the workplace, upon people's lives, upon the work that they will do, we must really think about the recommendations which are part of the latter part of the report, and how we focus our attention to make the difference to the people who need it the most. I guess what we then see in terms of the last part of the report is starts that so what section. So we've set out these projections, and what we can see, and we have our person at the core of this, our resident, and it's estimated that about 15% of people's health and well-being is made up of health and care services. So what we've done in this last section of the report is started to draw out some of the evidence-based examples already, and we'll be looking at those in more detail over the coming year to ensure, again, that our attention, our effort, our resource is focused in the right way. However, what you can see in terms of the health and social care section are a few key examples, and one of this is about best start in life. You know, that is a really clear evidence-based approach, and the example there, building on work you'll see early in the report with our kind of parent and carer panels in our family hubs, is our matron for health inequalities and really focused work around breastfeeding, tobacco dependency and pregnancy, but offering that holistic support within our family hubs. So an example of how we can make that difference to some of those projections. And then estimated that about 40% of persons' health is influenced by our behaviours. But our behaviours are not just about individual choice, they are also about the environment in which we live, the policies and legislation that is around us. And smoking is a particular example because we have got quite a specific kind of trajectory to look to reduce smoking and almost to end smoking prevalence in our county. We have also just seen a reduction in our smoking prevalence from 15.4% to 11.7%, which shows that we can make a difference when we really put our effort into the right places. We need to do more work on that unfairness and the inequality, particularly where I drew out in relation to smoking at time of delivery. And you'll see in the report other examples in relation to healthy weight and also mental health and well-being. And finally, in the healthy behaviour section, work that we're doing in relation to alcohol and work to raise awareness of the link between alcohol and cancer, which often isn't really considered. And our regional alcohol office Balance are doing some very specific work in relation to advocacy and campaigning around alcohol, and also raising public awareness of that and issues such as minimum unit price. And then finally, about 45% of people's health and well-being is made up of the influences on them, whether they have a good home, whether they have a high-quality job, whether they have a good education. So you'll see a range of evidence-based examples in this section relating to those wider determinants. And the one I've drawn out here is the work with our education team, and education being a really important protective factor for people's health and well-being, and very specific focus on the mental health and well-being of children and young people. And I guess the next question is, have we got enough of that? Is it in the right place? And that will be the work that comes in the coming year. And we know, however, sadly, that 1 in 4 women in our county and 1 in 6 men over the course of their life will experience domestic abuse, and that is a real underlying driver of poor mental health or access to a job, and influences obviously sadly sometimes our deaths in the county. So the environment in which people live is really important, and our work in ensuring a safe environment for people who have been at risk of domestic abuse, and access. And the example here is a really fantastic work from therapy with some of the children that are affected by domestic abuse. So targeting people who need help the most. Again, an example of work that we are doing and will need to accelerate and extend. The report, as ever, has a series of recommendations, and I think probably the key recommendations is how we'll translate those projections into reality. There's an example there around tobacco, but we need those for all of the key areas so that really we can think about that unfairness and about mitigating that unfairness within the county and between our county and other parts of England. And in conclusion, that is that looking forward, focusing this year's report on that unfairness, but avoidable. These things are avoidable, and it can only be by working collaboratively, influencing right across the council and with our partners that we will and can make a difference to those inequalities. And it will require all of us working collectively with our communities to do so. And then finally, the report, obviously the recommendations are to receive the report and to publish the report. Thank you, Chair.
Thanks, Amanda. Can I invite Councillor Chris Hood, Cabinet Portfolio Holder for Adult and Health Services, to move the report, please?
Thank you, Chair. I'm pleased to welcome the independent annual report from Amanda Healy, Director of Public Health. This year's report, Unfair and Avoidable, Looking Ahead to Health in 2040, has a focus on the future health of County Durham residents. I'm pleased to see the work that has been carried out this year within the Health of Our People section of the report, where we have worked with a range of key stakeholders to produce a comprehensive dementia in County Durham needs and asset assessment to evaluate local dementia prevention, care and support. It's also good to see how the approach to wellbeing has been used to develop the Growing Up in County Durham strategy by involving stakeholders and families at an early stage to ensure it is written in a way that is easier for non-professionals to read. The report focuses on 3 factors which make the biggest contribution to lives being cut short: health and social care, healthy behaviours, and the wider determinants of health. In the wider determinants of health section, I'm pleased to see the case study which highlights how the Ambassador Programme is supporting people into training and employment. Addiction is an issue which affects many of our communities. The Ambassador Programme will have a positive impact on reducing the rates of major illness as it improves people's mental health and physical health and the wider circumstances in which they live. It's great to see the recommendations that are highlighted within the report, which build on existing work and identify new opportunities. I look forward to future annual reports where we can report on the progress we are making to ensure that the projections set out in this report do not become a reality. I'd like to thank again Amanda Healy, and I therefore propose that Cabinet agrees to publish this report. Thank you, Chair.
Thanks, Chris. Can I invite Councillor Richard Bell, Deputy Leader and Cabinet Portfolio Holder for Finance, to second the report, please?
Thanks, Chair. I'd also like to thank the Public Health Director, and I'm happy to second the annual report for 2024. The report highlights worrying national projections developed by the Health Foundation and applies these to our local population. For example, for anxiety and depression, this shows us that by 2040, a total of 89,700 people in the county could be living with anxiety and depression, and that's an increase of 17,400 people, or 24%. The report has positive examples of what can be done to address some of these issues. So I'm pleased to see, for example, the case study which highlights how Tanfield Lee Primary School created a positive way for children in their school to communicate their concerns and worries as part of the Durham County Council Health and Wellbeing Framework for Schools. The children have found it really valuable and have had lots of other ideas and comments to improve wellbeing. The projections highlighted within the annual report are challenging to read. However, over the coming year, we must use this report to guide our resources to best meet these challenges. No work to improve public health can be achieved without working with others, our partners, and most importantly, our local communities. I'm therefore happy to second the report and the recommendations at paragraph 5.
Thanks, Richard. Is there anyone else wishing to speak to the report? No? Can we agree the report and its recommendations? Okay, I can confirm the recommendations are agreed. Item 6 is Adult Social Care Update on the outcome of the Local Authority Assessment by the Care Quality Commission under the Health and Care Act 2022. Can I invite Michael Lang, Interim Corporate Director of Adult and Health Services, to present the report, please?
Thank you, Chair. This report provides an update on the outcome of the CQC assessment and seeks approval of the Service Improvement Plan, addressing the areas for development for which we will provide annual progress updates. Cabinet will recall that the CQC assessment started in January 2024 and consisted of various stages over a 6-month period, including a 3-day on-site visit. Durham County Council received an overall CQC rating of good. The assessment team from CQC also found that over 85% of CQC regulated provision across Durham was rated good or outstanding. The service has a focus on continuous improvement, and a Service Improvement Plan 2024-25 has been developed, which is in line with the Council's Corporate Strategic Planning Framework. The Service Improvement Plan is in 2 parts, Chair. Part A sets out the strategic and transformational projects to improve high-quality services, maximise productivity and ensure that the MTFP financial contributions are met. Part B specifically focuses on the improvement activity aligned to the 4 themes in the CQC assessment framework, building on the self-assessment outcome. The delivery of the Service Improvement Plan will be managed in line with existing governance arrangements, using the Services Quality Assurance Board and the Corporate Oversight Group. Communications and engagement are a vital component of the work around the assessment, and the robust communications plan that's been in place since the start of the process will continue in the future. Chair, it's recommended that Cabinet notes the positive outcome of the CQC assessment and approves the Adult Social Care Service Improvement Plan 2024-25, agreeing to an annual progress update report. Thank you, Chair.
Thanks, Michael. Can I invite Councillor Chris Hood, Cabinet Portfolio Holder for Adult and Health Services, to move the report?
Thank you, Chair. I'm pleased to present the Adult Social Care Report, which provides an update to Cabinet on the outcome of the CQC assessment and seeks approval of a Service Improvement Plan addressing areas of development identified by CQC, as well as our wider service improvement aspirations. The CQC rating of good tells us that we are doing really well in how we deliver adult social care in Durham, in line with the statutory requirements of the Care Act. Most areas within the assessment were found to be of a good standard, and the service is performing strongly and meeting the expectations of the CQC. The Service Improvement Plan has been developed to address those areas which were highlighted as needing improvement and build upon the work that was already in progress following the writing of our self-assessment. The service has a strong focus on continuous improvement, and I look forward to receiving further updates on the progress made with the Service Improvement Plan. I'm keen to congratulate the Adult and Health Service and indeed the Council in achieving such a positive assessment outcome, and I'm pleased to propose the recommendations set out in this report. Thank you, Chair.
Thanks, Chris. Can I invite Councillor John Shuttleworth, Cabinet Portfolio Holder for Highways and Rural Communities, to second the report, please?
Thanks, Chair. The CQC rating of good is very positive and provides reassurance that the service is delivering its priorities effectively, is meeting CQC expectations. The approval of this service improvement plan will ensure that the actions are being progressed and monitored throughout appropriate governance arrangements, and that continuous improvement is embedded across the service. On that basis, I'd like to second the recommendation set out in the report. Thank you.
Thanks, John. Is anyone else wishing to speak? If I can just say a few words then. So I would like to add Cabinet's thanks for this report to Jane Robinson. Jane is our outgoing Director of Adults and Health Services. I'd like to thank her for all the work that she has put into this, for all the work she's put into DCC, the work and commitment in the CQC assessment, but also for her years of dedication in her role and for the good position she's left the service in for Michael to succeed. I wish Jane well in her retirement and also Michael all the best as her successor. She is a hard act to follow, so good luck. Thank you. Okay, can I confirm the recommendations are agreed, please? Okay, so confirm that. Item 7, Public Sector Equality Duty Annual Review 2023-24 and Equality Policy. Can I invite Steve Evans, Head of Corporate Affairs, to present the report, please?
Thank you, Chair. Good morning, everybody. Steve Evans, Head of Corporate Affairs. Equality and diversity are at the heart of Durham County Council's vision and core values. We're committed to promoting equality and diversity as an employer in the services we deliver, in working with partners, and in the decisions that we make. Our equality objectives come out of consultation on a shared vision for County Durham 2035 and have been reviewed and refreshed as part of consultation on the Council Plan. They help us focus on key areas of improvement for disabled people, inclusive communities, and a welcoming employee culture. These objectives align with the Council ambitions set out within the Council Plan. This annual review sets out our progress against those objectives and how we meet the public sector equality duty. For example, we're proud to be a disability confident leader, and through this scheme we also provide support to local employers to improve their practices in support of people with disabilities into sustainable local employment. Children's Services have delivered on their pledge of offering high quality anti-racist practice training to their staff. We've improved disability access through working closely with disability groups on the design of Durham Bus Station and the Story. Our employability service, Durham Enable, achieved an excellent accreditation from the British Association for Supported Employment. Our staff networks not only provide a valuable source of support to staff, but also help us design inclusive services responsive to customer needs. The networks provide visibility in our communities through their support of activities such as Durham Pride, public health initiatives, Armed Forces Day and Black History Month. We've also taken action to close the gender pay gap. Cabinet has recommended to adopt the refreshed Equality Policy 24-28, approve publication of the Public Sector Equality Duty Annual Update, and note updates for staff networks and for the funded Changing Places Toilet programme. Thank you, Chair.
Thanks, Steve. Can I invite Councillor Alan Shield, Cabinet Portfolio Holder for Equality and Inclusion, to move the report, please?
Thank you, Chair. Can I also thank Steve and his team for this comprehensive update on our equality agenda. The annual review of how we meet the public sector equality duty and the refresh of the equality policy. All elected members and council employees must take responsibility for equality and inclusion in the provision of excellent council services and also in their working relationship with colleagues, partners and members of the public. I'm pleased to note that the work that we are doing as a council is promoting and advancing equality for all of our communities across County Durham. Inequality affects people in different ways, and our annual review sets out examples of how we tackle this and raise visibility for all groups across the whole of the county. We are always striving to improve disability access and have recently delivered 5 new changing place facilities, using grant funding which the council successfully secured from central government. These new facilities have been built at Locomotion, Hardwick Park, Raby Castle and Teesdale Leisure Centre. This brings the total number of changing place facilities across County Durham to 19. That is just one example, Chair. Equality analysis is embedded in our reporting and decision-making processes to assist and to support decision makers to understand the impact across different groups, and it provides evidence how we discharge our responsibility for public sector equality duty. We strive to engage and consult with all of our communities that we serve, and we do this through the involvement of our groups. For example, the Youth Council, the Disability Partnership, the North East Rainbow Alliance, and especially including our staff networks. I propose that Cabinet adopt the refreshed equality policy, approve a publication of the Public Sector Equality Duty Annual Review, and note the updates provided on the Changing Places Toilet Funding Programme and our network across the whole of Durham County Council. Thank you, Chair.
Thanks, Alan. Can I invite Councillor Ted Henderson, Cabinet Portfolio Holder for Children and Young People's Services, to second the report, please?
I'd like to thank Steve and his team for the report. It took a lot of work and has been exceedingly comprehensive. And in view of what has been said before, I would like to second this report. Thank you.
Thanks, Ted. Is there anyone else wishing to speak to the report? Okay, can we agree the report and its recommendations? Okay, I can confirm that the recommendations are agreed. Item 8, there's no other business for the meeting this morning, so I'd like to thank everyone for taking part and to those members of the public and media who have watched the meeting online. That concludes the meeting. Thank you.